Hello everyone, welcome. After so many days, I'm posting my video. Sorry for that, but I was not well uh, right now also. But okay, I'm taking medicine and better. So, coming back to the video now. So, this topic was left in that is your birth control methods and your about now fertility, isn't it? Infertility problems, how we are going to deal with that. Okay, because in the present scenario, we are finding with the lifestyle that we are leading and many other factors, the kind of food and all is has an pollution. All these factors have aggravated these infertility problems. So moving on with the topic, let's first deal with the birth control methods and then the infertility problems. Okay, so coming on now, see, these are the contraceptive methods. So first of all, I will come on to the contraceptive method one by one with it. Now these are the natural method. Okay, so what do we mean by saying the natural methods? Means there we are not taking any kind of medicine in that. Okay, first of all, secondly, the first thing that is there is periodic abstinence. You have read about menstrual cycle now. In menstrual cycle, what was happening? Ovulation was taking place, isn't it, on the 14th day. Now on the 14th day, ovulation was taking. So there is a, you have a period of 28 day cycles. Now women have to be very careful if they are following this cycle, and I must tell you that this is highly the risk factor is very high in this case. The possibilities of becoming pregnant is very high in this case. Now even if you have your cycle, of 28 days, and you know that this day, your period started and this period again is started, you have got this cycle. Now within that cycle, on the before your 14th day, for a week, and after that week, you have to avoid no, mm, intercourse, sexual intercourse. Okay, so that is there. And but I must tell you, still the it's highly risky method. All the natural methods now except your lactational amenorrhea, both are risky method. So if I talk about coitus interruptus, in case of coitus interruptus, see what is happening is that, okay, while that no, sexual intercourse is going on, and at the climax of it, when the semen needs to be ejaculated, at that time the male partner has to just take out that penis, and then uh, he has to release that sperm outside, the semen outside. Now again, it's a highly risky method. One doesn't knows at times, and the semen moves into the vagina. Now, the third one is your lactational amenorrhea. In this, what happens? The breastfeeding mothers, what is happening? After the birth of the child, the mothers feed the baby. Okay, therefore it is called lactational amenorrhea. At that time, what is happening? That the females, they don't. No, there is not. Menstrual cycle, amenorrhea, that's why the name is. Okay, so what is happening there, that there is a pattern of pulsatile release of LH, which is happening from your pituitary. Now what is happening, this LH release is not happening in that form, that estrogen surge and then LH surge. I have told you already, you know that it happens before ovulation, so it is not happening in them. Okay, so there is an inadequate pulsatile release of LH, and therefore ovulation doesn't takes place, and therefore uh, it's a method by which no pregnancy takes place. But yes, if the mother is lactating for 1 or 2 years, so it's not that way you keep on lactating and this will keep on happening just for 6 months. Okay, and after that you have to take some other preventive measures. Okay, Now moving on. Now this is your artificial methods, means that we are using something from external source. Okay, though there are different methods for it. Okay, like your barrier methods are there, where people use what, now they like condoms are there, isn't it? So we will come to these, each of them, like oral contraceptives are there. So barrier methods, like cervical caps are there, which females use. So oral contraceptive is there, where it is pills. So we will talk about them. IUCDs are your intrauterine devices, okay, like copper T and all. So one by one I will be talking about them. And then implants are there under the skin, and all implants are there, which contain the hormones only, and how do they regulate. And then comes your surgical method. Okay, now there is a term which is called as medical termination of pregnancy. See, this is that Amendment Act has been given in the year 2017, in which now it was given that was enacted by the government with the intention of reducing the incidence of illegal abortion and consequent maternal mortality. Because what happens, that this medical termination of pregnancy means that the you can terminate the pregnancy under certain conditions. Okay, and secondly, here the termination should happen within the first 3 trimester. If the month has gone over, okay, 4 or 5 months or 6 months, then you should not go for this abortion, because it is not um, safe for the mother as well as the child. Okay, so and basically we go for this abortion in certain cases, like unwanted pregnancy has happened, and in case like the child is detected with some, the fetus is detected with some genetic abnormality. Okay, then in these cases we go for your medical termination of pregnancy. So coming to this oral contraceptive pills, as I was telling you, these oral contraceptive pills, they are basically your hormonal based pills, okay, and they have got now high level of progesterone and estrogen, okay. So in varying amounts they contain, and they prevent. How do they act? They're preventing the ovulation, and they may even affect the endometrium, so which is making not suitable for implantation, and therefore prevent implantation. It's highly effective because it regulate, and it also, the advantage is that it regulates your menstrual cycle. And the second thing is that minor discomforts like headache and all those things can be seen in some women's. Okay, and basically how does it prevent ovulation? By inhibiting the secretion of FSH and LH from your anterior pituitary. Remember that thing, that it prevents what, secretion of LH and FSH. So LH and FSH secretion is prevented, therefore it inhibits your ovulation. And it's very highly regulates your menstrual cycle, and it's highly effective. Okay, and minor side effects like headache, sometimes it may lead to excessive bleeding, all those things may happen. Okay, so women, those who smoke, should not take it. Now coming back to your injectables, they are also hormonal based, and they are injected under the skin and intramuscularly, and they also inhibit, because they are hormonal, as you know, they inhibit ovulation. Effective, very effective, and very long lasting. Okay, so here we find there are disadvantages, that irregular menstrual bleeding is seen sometimes, and fertility in this case may not return for 6 to 12 months after contraceptive is discontinued. Okay, so this is another criteria which we should take into account. Okay, now coming to your intrauterine. Okay, this is your intrauterine, this is I, So this is your intrauterine devices, like you have read about Lippel's loop, copper T. These are your intrauterine devices which are now injected into the uterus of the female. Okay, and probably it stimulates inflammatory responses and prevents implantation. Okay, and they also causes phagocytosis of the sperms. Okay, so these are some of the various things which are observed in them, and it provides continuous protection, highly effective. uh, and it might, the side effects are that it causes cramps, increased menstrual flow. Yes, it is observed increased risk, and pelvic inflammatory diseases might result, and infertility also it can result. Okay, so not recommended for women those who had uh, not at all a child. Okay, so these are the things which one must see whenever you take any of these contraceptive methods. Now, first of all, these contraceptive methods should be what? They should be very safe. They should be what? Safe. They should be reversible. Okay, so depending upon key, they should be easy to use. Okay, they should be safe, they should be easy to use, and they should not be causing any no, discomfort. If they are causing any kind of discomfort, no, discomfort, sorry, uh, discomfort, um, during intercourse, na, then they are not good contraceptive method. Then one should change the contraceptive methods. Okay, so it should be safe, it should be reversible, it should be easy, it should not it should be comfortable during sexual intercourse. So all these pointers, and we have to take into consideration. Okay, and another is your spermicide foams and jellies and creams that we see, and these are chemicals which are applied that kills the sperm. So no side effects is known, but now it should be applied, it should be done along with some other contraceptive methods like condoms and all. So before applying condoms and all, these jellies could be applied. Okay, because if you alone use this, then it is highly risky method. Okay, now if I talk about condoms, so it is what? It's a barrier method, and condoms are very, effective in a way. Key condoms or cervical caps, like women can use cervical caps, no, uh, which acts as a barrier for the vagina and all. And if the female is having any kind of inflammation in the vagina or any infection, should not go with these cervical caps. Okay, and condoms, if we look at, no, they are barrier method and good method. Why? Because they protect from STDs. They are the only method that protects from STDs, that is your sexually transmitted diseases. Okay, so uh, they no they prevent the sperm from reaching the fallopian tube, your barrier methods, isn't it? Okay, and the these are the methods. Now we are moving towards the and they are very effective. This method, condoms, is very effective. It's 90% effective rather. This method is very highly effective. Okay, and that decreases. Okay, now we are moving towards our uh, surgical methods. So coming to the surgical method, here is the two method that is shown. First is your what? This is what showing your what? It is showing your vasectomy. As you can see that the vast difference, you can see here the vast difference is what? Cut and ligated. It is cut and ligated. Okay, now in this case what will happen? There is no problem in sexual urge and anything like that. The myths are there in that. The only problem is with the reversibility. If the person doesn't want child at all and had children earlier, then only should go for this method, otherwise not. Because here the chances of reversibility is very poor. Okay, so this is the only thing here that is a problem. Okay, and with the tubectomy also same thing, because both the surgical methods and tubectomy, what is happening, the oviduct, now the oviduct is being cut and ligated, as you can see here. Here it's, if you focus on what is happening, it is cut and ligated, so no more ova is going to reach into the uterus. Now sperms won't be able to reach and won't be able to fertilize. Okay, so this is what we find in case of our surgical method, and it should be the last method, I feel, because it's highly irreversible method. Okay, so once you have gone for this method, you don't if you want in future children, the chances are that, okay, you have to go for other uh, now coming towards your sexually transmitted diseases, not much is given in your book, NCERT, and I'm following your NCERT. If you want to know about it more, please write in the comment box. Then I will prepare another slide for it, another videos for it. Then I will talk about it more. Okay. Now in this case, what is happening? You can see here that the infections or diseases which are transmitted through sexual intercourse, okay, they are called as sexually transmitted disease, I hope you know. Or they are also called as venereal diseases, okay, or a reproductive tract infections. Okay, RTIs भी होते हैं, and if now except your hepatitis B and genital herpes and HIV, other diseases are completely curable if detected early. Okay, and incidences are reported to be very high. In which age? Look at it, this is really alarming, that 15 to 24 years of, because why it's happening that this age group is having high amount of sexually, and the major barrier is that one feels ashamed, doesn't share with their parents or anyone, and they keep suffering with this disease, and at times it comes that it becomes incurable. Okay, so and in this case, if you look at today's scenario, 15 to 24 years of age people are suffering a lot. Why is it that they are suffering a lot? Because you see, with this age, they don't have much knowledge about it. Okay, one thing is that they don't have knowledge. Okay, they don't have knowledge about it. Secondly, they more believe on what, on your media, and they gather information, and they don't know whether the information they are gathering is right or wrong. Okay, and there is so much of information there now ki you get confused, so you need here a kind of a no counseling, as well as a correct kind of information should be given to you. So you should consult a person who knows about it better, rather than what mainly I have done a even a no in this population study, if you even do, I have found that, and I have done with, because I deal with kids, I have seen that the majority of them, they consult their peers. And when you consult with your peers, you don't go to elders, then what is happening? You are in the same age, and both of you are under the same myth, and the just trial and method. And at this age, mostly people, they are what, they like to just try out things. And I must tell you ki yes, you are reproductively active, but you are still not mature enough to hold the responsibility of a child. And people engage into these things, and later on they find, and I tell you, a lot of infertility problems are also rising because of it. And many cases have been seen that they later on with age, they are becoming infertile. Okay, many kinds of infertility problems arises in people. Okay, so these are the major things. So we really need to be cautious about this age, because at this age people think, okay, I'm grown up, I know what is right, what is wrong, but still certain things I hope you should take, help of your elders. Okay, now moving on to this infertility. Now let's look at the reasons first. What is the cause of this infertility? Already I've told you what are the cause of the infertility. Okay, so coming to that, cause of the infertility, if you look at reasons, this could be many. Physical reason could be, it could be a congenital, it could be a disease, it could be a drug, it could be immunological or even physiological. Now reasons could be there for infertility. Okay, so it could be by congenital, means by birth. It could be certain disease which has affected, drugs you have taken, immunological or even psychological problem or physical problem is there. Okay, like many people now they are not able to, there is which we call as erectile dysfunction. The pain is they don't erect during that intercourse, and therefore they are not able to satisfy their partners. Okay, so there are different kinds of infertility problems are there. Okay, now coming on to this, okay, specialized healthcare units are there. Like though you are infertile, see there is a difference between the two words, I must tell you, that is your infertility and sterility. Sterility cannot reproduce at all. Okay, and infertile ones, they are chances of using certain methods by which no, they can bear the child. So they are not completely sterile, but yes, the fertility is less, that is infertile. Okay, so they might be having certain problems. So now today's scenario, we know that there is lot of now clinics have been come up, which are what your infertile clinics आप देख रहे हैं towards up city में. Like if you go back to 20 years back, there was no infertility clinics. Now every city has got this infertility clinic. Really, it's a thing which we need to ponder upon. Okay, so by which we could help in diagnosis and corrective treatment measures they do. And remember, these are highly methods which are requiring lot of effort, also lot of money, and lot of hormonal treatment you have to go through it. Okay, through special techniques. Okay, and now we call them as what? We call it as assisted reproductive technology. We call it as ART, assisted reproductive technology. Now let's come one to one, each one of them. Now first is your test tube baby program. First try to understand these terms. What is test tube baby program, and what do we mean by saying in vitro fertilization? Okay, so what do we mean by saying this in vitro fertilization? So in vitro fertilization means in vitro fertilization, it means that something is done. There are two terms, in vitro and in vivo. In vitro means you are doing something in the laboratory. Okay, in vivo, which is taking place within body or within cells, you can say. Okay, so it is taking place within your body, you can say. Right now in this context I will say, so it is taking place within your body. When it is taking naturally, then we call it as in vivo. And when we do this thing outside in a laboratory, in a test tube, we call it as in vitro fertilization. So in test tube baby program, what is being done? Your gametes, like your egg, is taken out, your sperms, and they are fused externally. Okay, so there is a lot of things which is being done. Like now further, see, women take fertility drugs that induces ovulation. Okay, and they release several eggs, and then these eggs are retrieved by needle. Okay, so through the vagina. Okay, the eggs are then placed in a dish with sperm and fertilization to take place in vitro. Now fine. Okay, so what do we find here, that the embryos are cultured for 3 to 5 days and then now screened for chromosome, okay, for gene abnormalities. So after taking out, giving the hormonal treatment, then taking out the eggs and the sperms, fertilizing them, what we do, we do the screening. This is very important part of your reproductive, this assisted reproductive technology method. They screen whether is there any kind of abnormal chromosome, or whether the egg, now screening of the egg is also done initially, whether the egg is of nice condition or not. Okay, then the healthy ones are then transferred now into the uterus through the vagina. Okay, so this is your IVF technology. Okay, now IVF was first used in England in 1978. In 1978 it was first used in England. Okay, uh, okay, now let us move towards this gamete uh, intrafallopian transfer. In this, what is happening, a laparoscope is taken, okay, and used now to guide the transfer of eggs and sperm into the woman's oviduct through a small incision, okay, in her abdomen. So through laparoscope, what they do, now here the egg, remember, here the egg and that sperm is placed in the oviduct. Now what is happening here, the gamete could be from a donor also. Okay, maybe the mother is not able to produce the egg, then a donor could supply, even the sperms could be supplied by the donor. Okay, so this kind of a treatment, we call it as, where the gametes are introduced into the oviduct through a laparoscope, okay, by creating an incision in the abdomen as gamete intrafallopian transfer. Okay, now then comes your what, comes your gift, that is your gamete zygote intrafallopian transfer. So through laparoscope, here what we are doing, fertilizing the zygote outside and then transferring that zygote into the fallopian tube. Okay, so remember, these processes are highly expensive. Okay, I must tell you. Okay, and the another is your intracytoplasmic injection. I will come to that also, and your artificial insemination. See, let's first talk about artificial insemination. And artificial insemination, if you look at, is the most common assisted reproductive technology method. Initially, first trial any doctor will give you with this, now if now there is the case of oligospermia, that is the less amount of sperms are produced in the semen, contains less amount of sperms, then they go for this, what they do, they concentrate the semen so that more and more sperms are concentrated, and then they inject the sperms directly into what, into the cervix or the vagina. Okay, so as you can see here, just let me show you, it is, so artificial insemination, it is done in the uterus or the cervix region, we insert it, and it is also called as what, intrauterine insemination. Intrauterine insemination. Okay, and we have seen this method. Now moving on, this method is your what, this is your intracytoplasmic injection. See, the diagram is showing you here, this is the, this part which is it's showing you this part is your egg. Okay, and you can see this is your micropipette. One pipette is holding the egg, and another pipette, what is happening? The nuclei is being directly of that sperm is being injected into the egg. Okay, so making very sure that the fertilization is taking place. So this is called as what? Intracytoplasmic injection. Okay, and after that the zygote is formed, and then by a gift method, it could be transferred to the donor. Okay, now I must talk about something like surrogacy. You must have heard the word surrogate mother, surrogate or surrogacy, I can say. Okay, so in case of surrogacy, what is happening? A womb is then hired. In this case, you can say, so a womb is hired. So the person who is giving the birth to the child is not the real mother. It's not the biological mother. Okay, maybe at times what happens, the woman is not able to, the uterus of some females are not able to hold the baby, and therefore they find that most of the time it aborts. So in that case, what is done, a womb is hired. Okay, and a mother uh, zygote is then put into the, and then that female has to undergo hormonal changes so that her uterus becomes what? Receptive for that zygote to be implanted. Okay, so although talking about it, it seems to be simple, but these methods are highly complicated methods, and lot of hormonal treatment one has to undergo in it. Okay, the surrogacy uh, could be like in this is what is basically surrogacy. Okay, where the surrogate mother is not the original mother, but at times it could be also that the mother is not able to at all uh, produce the egg. Then the surrogate, in that case surrogate mother is giving the egg also, then she becomes the biological mother then in that case. Okay, so this is about it. Fine, so now I have reached to the end, and thank you for watching it, and please subscribing my channel, and God bless you all.